Good afternoon, everyone. My name is Jeannette Karim, and I'm speaking to you today from my home in Edmonton, which is located within Treaty 6 territory and within the Métis Homelands and Métis Nation of Alberta Region 4. I would like to acknowledge this land as the traditional territories of many First Nations, such as the Cree, Dene, Stoney, Saulteaux, and Blackfoot. So I completed my final practicum with the Public Health Agency of Canada, and today I'll be talking to you about best practices in questionnaire design when collecting public health data. I'd also like to take a moment to thank my practicum supervisor, Michelle, and I see that she's online today. So hi, Michelle, and thanks also to the rest of her team. I feel so fortunate to have had the opportunity to learn from you. And I'd like to also thank all of the University of Victoria faculty and staff who I've worked with throughout the journey of my degree. So many aspects of public health practice are based on or informed by high quality data. And we use this data for surveillance and for planning, implementing, and evaluating public health interventions. Characteristics of high quality data are completeness, accuracy, and timeliness, meaning that the data covers all aspects of the topic and target population. It reflects the truth, and it is up to date and acquired within a reasonable time period. So there are many methods of collecting data, and I'll be talking today about questionnaires or surveys. So if a survey is your method of data collection, you want to ensure that your tool is going to provide you with the best data possible. And I'll be discussing strategies and considerations for how to achieve this. So during my practicum, I completed a literature review with an objective to identify best practices in survey design. I reviewed 24 academic sources, and then I organized the findings of this literature review into 4 main themes that I'll be discussing today. I would also like to preface this by talking about 2 of the most important survey characteristics, which are reliability, which refers to the extent to which similar results can be achieved through repetition, and validity, which refers to the extent to which a survey measures what it was intended to. So in order to collect good quality data, it is important that a survey strives to be as reliable and valid as possible. The first major theme I'll talk about is survey delivery mode. There are 2 main types of surveys. So interviewer-led surveys are where someone asks a respondent questions. And this can be done in person or over the phone. And then there are also self-administered surveys where the respondent completes the survey independently, for example, with a mail or web-based survey. Interviewer-led surveys can be good for surveys that have complex or ambiguous questions because the interviewer can help clarify the questions if needed. These types of surveys are at risk for interviewer bias, which occurs when the interviewer intentionally or unintentionally can cause bias in the way they ask the question, such as through the words they emphasize or the tone of their voice. Interviewer-led surveys are also at risk for social desirability bias. And this occurs when the respondent feels pressured to provide an answer that they think will most please the interviewer or make them look better. Web-based surveys in particular have become much more common due to advancements in technology. And these generally are more cost-effective and easier to implement. And they are typically also more convenient and confidential for the respondent. However, these can be more prone to having non-representative samples. And this type of survey can also be challenging for populations with literacy or internet access limitations. The second theme relates to survey errors and biases. So survey error is a term which refers to a deviation of a survey response from its underlying true value. And this is problematic because it can affect the accuracy of the data collected. There are several different types of survey error, and I'll just review a couple of examples here. So measurement error occurs when incorrect responses are captured. And this can be caused by a lack of clarity in questions, or it can also occur when the respondent intentionally answers inaccurately. Frame error occurs when the target population has been poorly defined. So the respondent pool may be too narrow or too broad for what the survey is intended to capture. And now I'll discuss the way some questions can cause errors or biases. So first of all, the way a question is worded and the connotations of words can influence the way a respondent answers, even subconsciously. And the order of questions can also matter. So for example, in a satisfaction survey, expressing satisfaction in a first question can increase the likelihood of a respondent answering in a similar way with the next question. Surveys should also avoid the use of leading or double-barreled questions and ambiguous terminology. A leading question is when the question is phrased in a way that sort of nudges a respondent to answer in a certain way. So for example, asking, how good are our cleaning services, can make people more likely to focus on the word good and thus answer in a more positive way. A double-barreled question is a question that tries to answer two concepts at once. So for example, asking the question, do you like dogs and cats? Can be a difficult question for someone to answer if, for example, they love cats but have a fear of dogs. And ambiguous terminology can also be problematic in a survey. So for example, in the question, do you regularly exercise? The term regularly can be unclear and it may mean different things to different people. And the same thing with the word exercise. So if different people have different interpretations of this question, their responses may not be comparable, and they also may not be answered as the survey designer intended. The third theme is related to question design. When designing a survey, there's the option of including open-ended or closed-ended questions. Open-ended questions can provide very rich data, but they are more time-consuming for the respondent to answer, as well as for the researcher to analyze the data from. Closed-ended questions are generally much simpler to answer and analyze, but they are not always able to capture as detailed of data. A survey can also be mixed methods, which means it uses a combination of open and closed-ended questions. The literature repeatedly emphasized the need for a good survey to minimize the burden on the respondent. And this means it should be as easy as possible for them to complete the survey. If it is a self-administered questionnaire, the layout should be user-friendly and should have a readability level appropriate to the target population. Questions should be as clear and simple as possible, and the survey should be brief because respondents are at risk for becoming tired or annoyed with the survey, which could decrease the quality of the data. Finally, theme 4 relates to the importance of pre-testing a survey, also known as piloting. This is where the survey is tested on a small scale before it is implemented more broadly, and it allows you to refine and improve the questionnaire as needed. Pre-testing can help measure the survey's comprehensiveness, relevance, clarity, and ease of use. There are many different approaches discussed in literature for how to pre-test a survey. One method is to do a cognitive interview with the pilot group. And this means that even if the survey will be self-administered when it is launched, the piloting stage requires the test respondents to read the question out loud and verbalize their thought process as they answer the question. And this can help researchers better understand how a question might be interpreted by a respondent in the target audience. And it can also help identify sources of bias or lack of clarity. Another example of a piloting approach is to use subject matter experts to review the survey to determine if it is comprehensive, if the questions are relevant, and to identify any gaps in the survey. There are, of course, many other approaches to pre-testing a survey, and these are just a couple of examples. In summary, data is fundamental to virtually every aspect of public health practice. But having data is not enough. It really needs to be high quality data. And that means it should be complete, accurate, and timely. There are many ways to collect data for public health. And if you're using a survey, it's important that it is well designed so that it can collect reliable and valid data. A literature review identified various aspects of best practices in survey design, and I shared with you some of these considerations. So thank you all for listening. I hope you have a great afternoon. And at this point, I can take any questions.